Hi, my name is Ashley Mills. I currently work in the cardiac cath lab at Iowa Methodist Medical Center in Des Moines, Iowa. I work as a staff nurse in the invasive side of cath lab, and I work as the unit-based educator for the invasive side. I have been in the cardiac cath lab for 8 years with previous nursing experience in cardiac surgical ICU and the post-anesthesia care unit. In the cath lab at Iowa Methodist Medical Center, we care for the adult population. We currently do not care for pediatric patients. If a pediatric patient needs a cath lab procedure, they will have to transfer them to a hospital that cares for pediatric patients. In the cath lab, we care for patients with several conditions such as coronary artery disease, valvular heart disease, and heart failure. Key knowledge and skills a cath lab nurse must possess include cardiac anatomy and physiology, cardiac procedures, pharmacology, hemodynamics, radiation safety, sterile technique, critical thinking, and clinical judgment. Many of these skills will be fine-tuned during the orientation process. Cardiac anatomy and physiology will include knowledge of coronary arteries, electrical conduction of the heart, and venous versus arterial blood flow. Cardiac procedures performed in the cath lab are something you will learn as you move through your orientation. Pharmacology includes medications that make the patient comfortable during the procedures, life-saving medications, medications that prevent blood clots, and other medications as prescribed by the cardiologist. Radiation safety is covered with your preceptor, and you will complete learning modules to keep yourself safe in radiation. The unit-based educator provides sterile technique education. Critical thinking skills and clinical judgment are developed over time in the cath lab. Key competencies in the cath lab include assessing and monitoring a patient, documentation in the electronic record, collaborating care with patient and families, performing various procedures in the cath lab, operate and monitor medical equipment, and then education for patients and families. Some common medications used in the cath lab include heparin, nitroglycerin, fentanyl, Versed, Plavix, and Brilinta. Heparin is an anticoagulant used during a coronary angiogram to thin the blood and prevent blood clots from forming on the equipment used for the procedure. Heparin is given through an IV. Nitroglycerin is administered in the cath lab for several purposes, including treating chest pain, managing coronary spasm, and preventing radial artery spasm during the access process. Nitroglycerin can be given IV, sublingual, arterial, or intracoronary. Fentanyl and Versed are used together to keep a patient calm, comfortable, and treat any pain they may be feeling. Fentanyl and Versed are given through an IV. Plavix and Brilinta are antiplatelet medications given to patients post-percutaneous coronary intervention or stent placement. One of these medications is typically given with aspirin to prevent blood clots from forming in the vessel or stent that was placed. These medications are given orally. Now let's look at the diagnosis a patient may have prior to coming to cath lab or after they've been in cath lab. Coronary artery disease occurs when there is a narrowing or blockage in the artery. This can be assessed by doing a coronary angiogram. Valvular heart disease is when there is narrowing or leakage around the heart valve. This can be assessed during an echocardiogram, a left heart cath, or a right heart cath. A pulmonary embolism is a blood clot in the lungs. These blood clots can be removed in the cath lab using certain devices. Heart failure can be assessed in the cath lab during a right heart cath, left heart cath, or a coronary angiogram in conjunction with those two. Heart failure is when the heart cannot pump enough blood to the rest of the body. Cardiogenic shock is when the heart cannot pump enough blood to the body, typically caused by a heart attack or a severe heart failure. There is no typical shift in cath lab or anywhere in healthcare, really. The beauty of healthcare is that every day and every patient is different. But let's talk about some of the procedures that take place in the cath lab. It is important to understand that there are two different areas in the cath lab. There's the coronary side and there's the electrophysiology or EP side. The best way to explain this is that the coronary side looks at the blood flow in the arteries of the heart, or the plumbing side of the heart. And the EP side looks at the electrical conduction in the heart. Some procedures performed in the coronary lab include coronary angiograms, right heart catheterization, extracorporeal membrane oxygenation or ECMO, temporary transvenous pacemaker placement, permanent pacemakers, left ventricular assist devices such as an Impella, and coronary or pulmonary thrombectomy. In the cath lab, we also offer valve replacements such as a TAVR for the aortic valve. This is typically done for patients who are unable to have surgery to replace their valve. As a cath lab nurse, it is essential that we can assess our patients from head to toe, as some patients come from the ambulance directly to the cath lab due to them having a heart attack. A thorough assessment of the heart, lungs, pain, and pulses is necessary for every patient who enters the cath lab. In the cath lab, there are 3 roles that need to be filled to care for a patient properly. Those 3 roles are a circulator, which gives medications, hooks up the patients to the blood pressure cuff, EKG, pulse ox, and entitle CO2 monitoring, and they also hand off sterile supplies. The second position is a scrub person that assists the physician at bedside during the procedure, and a monitor person is the third position that charts everything going in and out of the body, keeps an eye on the patient's vital signs and cardiac rhythm. When you work in the coronary side of the cath lab, there may be call required. This call requires you to come in during off hours to care for patients that are having a heart attack, need a temporary pacemaker placed, or need a different emergent procedure. The process for sharing patient information in the cath lab starts with the patient's origin. Cath lab patients may come from an outpatient setting, a floor within the hospital, the emergency room, or an ambulance. Suppose a patient comes in as an outpatient. In that case, they are prepped for their procedure by a nurse in the cath lab recovery room, where that nurse will fill out a report sheet that covers medications such as any blood thinners or nitro a patient may have recently taken, their weight, allergies, pertinent history, and other information that the nurse feels is necessary. If a patient comes from the floor or the emergency room, a report will be called to the cath lab by the nurse who cared for the patient. If the patient is unstable, the emergency room nurse will bring the patient to the cath lab and give a bedside report. If a patient comes in via ambulance, the paramedic or EMT will provide report. The cath lab interventional cardiologist and cardiothoracic surgeons hold a quarterly conference that reviews interesting or high-risk cases, providing excellent educational opportunities for all staff members to attend. Nurses must possess compassion and empathy, which is the ability to understand and respond to the emotional and physical needs of a patient. Integrity is the adherence to ethical standards and honesty. Nurses also need autonomy. Another value that a nurse must have is collaboration, which is essential for a nurse. You need to be able to work with different disciplinary areas within the hospital and outside of the hospital, along within the department. Teamwork is essential when working in healthcare and in the cath lab. It takes a team to care for a patient in the lab. Communication is also key in ensuring patients remain safe while in the hospital or any healthcare setting. A communication breakdown can lead to adverse outcomes for the patient. Lastly, let's talk about the awesome benefits of being a cath lab nurse. Being a cath lab nurse is challenging, but you work in a fast-paced environment. You could earn an excellent wage due to the call burden that comes with being a cath lab nurse. You also are a member of a team that works together to care for the patient, and you make a big difference in the lives of our patients.